Hey guys, this is Dr. Hub. Today we'll look at the fats soluble vitamins. Fat soluble vitamins. So under this, we look at the vitamin A. So vitamin A, the active form, it is, first we're going to look at retinol. So retinol, it is, its deficiency leads to night blindness. There is night blindness, and there can also be presence of the xerophthalmia. Next is there is retinal. So we saw retinol, now this is retinal. So retinal, the deficiency, it leads to the, before moving on to retinal, let's look at the toxicity as well. So toxicity of the retinol, it leads to, it affects the lysosomes. It affects the lysosomes. Next is, we look at the retina. So vitamin A, it also includes the retinal. So in retinal, there is a deficiency. So what is the deficiency causing? So in retinal, the deficiency is leading to the acne as well as the psoriasis. So what is the toxicity? The toxicity is acute pseudomotor cerebri. So it is acute tumor cerebri, and also the exfoliative dermatitis. Next, we move on to the retinoic acid. The retinoic acid. So the retinoic acid, the deficiency, it causes the impaired. There will be the impaired immunity. And what is the toxicity of this? So this is the deficiency. So toxicity, it leads to the chronic fractures. It can lead to chronic fractures. Next, we are going to look at the vitamin D. So vitamin D, the active form is going to be 124 dihydrocholecalciferol. So 125 dihydrocholecalciferol. So what is the deficiency going to be like? So deficiency, it is nothing but in children, it is the rickets. Next, in case of adults, it will be osteomalacia. So what is the toxicity going to lead to? Toxicity will be the calcinosis. Next, we'll be moving on to the vitamin E. So what happens to the vitamin E? Vitamin E, its active form is going to be alpha tocopherol. And the deficiency, this is the active form. The deficiency of vitamin E, it can lead to, there is hemolytic anemia. Then comes, there is also the axonal degeneration. There is axonal degeneration. Then comes the spinocerebellar ataxia. There can be spinocerebellar ataxia. So what is the toxicity like? The toxicity, it is going to include there's reduced platelet aggregation, reduced platelet aggregation, and also there's going to be interference with the vitamin K. So it interferes with the vitamin K. Lastly, we'll move on to the vitamin K. So vitamin K, the active form it includes, there is a menindion as well as the menaquinone and the phyloquinone. So under all this, let's look at the deficiency. So the deficiencies it can lead to, there is the elevated prothrombin time and bleeding. There is elevated prothrombin time, and also there is presence of bleeding. Next, it can also lead to the hemorrhagic disease of newborn. There can be the hemorrhagic disease, and this is going to be of the newborn. Now let's look at the toxicity of the vitamin K. The toxicity can lead to hemolysis. Next, there can be hyperbilirubinemia. And there is also the kernicterus. Now the RD of vitamin D, we need to know that the vitamin D, the RDA is going to be in elderly greater than 60 years. So here the RDA, it is 800 IU. Now continuing with the required dietary allowance. So first we are going to see the vitamin A. In vitamin A, it will be 390. This is for the retinol, is going to be 390 to 630 mcg. This will be from 1 to 9 years. This is vitamin A, and it is 770 to 1000 mcg. This is going to be 10 to 18 years. This is completely in case of the children. Then comes the male. In male, we give 1000 mcg. This is vitamin A, and in case of female, it is going to be adult. In terms of adult, it is going to be 840 mcg. And the pregnancy, it will be 900 mcg. Lastly, in terms of lactation, it is going to be 950 mcg. Next, let's move on to the vitamin D. So in vitamin D, the dietary allowance is going to be 400. It is 400 IU. This is less than 1 year, and it is going to be 600 IU. This will be greater than 1 year. So what about in terms of males? In terms of males, it's going to be 600 IU, and females. In females, it will be for the adult. It is a 600 IU, and in terms of the pregnancy, it will be 600 IU. What about lactation? Lactation, it will be 600 IU. So everywhere it is 600. Then we move on to the vitamin E. So vitamin E, there is in adult, there is 8 mg. In pregnancy, it is going to be 10 mg, and lactation, it will be 12 mg. So requirement increases on lactation. Lastly, the vitamin K. The vitamin K, it is going to be 55 microgram. This is in terms of female. And previously for vitamin E we discussed this is for the females. Next, for children it is going to be 5 to 8, and for males it was 10. Now moving on to vitamin K, it is 55 microgram for females and also 55 micrograms. This will be specifically for males. And looking at children, in the children it is less than 1 year, it will be 2 to 3 microgram, and in case of children it will be 30 to 50 microgram.